The difference between a tummy tuck and a paniculectomy is that with a paniculectomy, all we're doing is removing the excess skin that's hanging, like after a skin fold below the pelvis. So we can remove that extra skin and close the wound and we're done. Typically, we do that only in folks who have a very large paniculus that is pendulous and hanging. It's not something that I would consider to be a cosmetic procedure. Frankly, I've only done a handful of those in my career, and I used to do a lot of work for folks who had lost well over 100 pounds. Bariatric patients were my niche for 10, 12 years. But most of the time I'd say to myself, well, if it's safe, why wouldn't I, for the same scar, why wouldn't I sort of snug up the abdominal wall and take away a little more skin and kind of try to tighten things up and make it prettier at the same time as I'm doing the paniculectomy? Sure, it's more work, but it is something to be considered when you're in that situation, when you're considering the options.